because I don't really identify as a woman anymore, as a female anymore. Now, okay, so cervical cancer screening is for anyone with a cervix. As long as you have a cervix, that cervix can get cervical cancer. So that goes for all women, all pregnant women. So it doesn't mean that when you're pregnant, you will not get a pap smear. It's not going to cause preterm labor. Because, you know, the doctor naman is not going to be so violent about the pap smear. Gentle yan. Okay, so yon. And then also, yung mga transgender, maybe they already dress externally as a male, but as long as they still have that cervix, they still need to get a pap smear. Number 4, yung mga non-binary, they don't identify either male or female sila or they're undecided. If they still have a cervix, it's okay, whatever you want to identify with, but we need to test that cervix. Also, for those who have already had hysterectomy, if it's a subtotal type of hysterectomy, that means the cervix is still there. We have to also again do a test on that cervix. Okay? So that's number 1 misconception. Number 2, I have no symptoms, therefore I don't need to go to a doctor. I'm okay. Kasi nobody really wants to go and have themselves examined. No, it's very, parang, it's too private.
It's scary also.
It's private, diba? Parang, you don't know, maybe some, they already know their doctor. Pero kung young pats, the first time they go to a gynecologist, they feel awkward about it. So they say, no, I'm not feeling anything naman, so wag na lang. But then, if you're working, if you have HMO, it's covered, no? 25 years old and above, or even earlier if you have symptoms, 21 years old, we already do pap smears for them. So, you go ahead, it's no big deal. You know, your gyna has done this a million times. It's not an issue for her, and she can walk you through the procedure so that you don't feel awkward or you don't know what to do. And then it's very quick, like less than 1 minute, no? And then number 3, third misconception is, I've already been vaccinated, therefore I don't need to do screening anymore. Well, no, that's different. No? So if you've been vaccinated, there's still a possibility. And even then, even if for whatever purpose, baka may iba pang ma-detect, not cervical cancer, maybe just normal bacterial vaginosis lang or something that's been bothering you, at least ma-detect kagad. So it's for overall health. It's not just for one particular disease, right? So those are the 3 major misconceptions that we're trying to clear up in our practices.
Thank you so much, Doctora. I think that